should we do re-biopsy in patients who are ALK positive, who have had disease progression or failure of crizotinib? And I think you can look at the question in many different ways. First, the next generation ALK inhibitors, of which there are several in development, ceritinib and alectinib seem to work in a high proportion of patients who are ALK positive, almost regardless of the mechanism of resistance. So one of the things that's been fascinating to me is that we predicted early on that the patients who would receive the most benefit from a next generation ALK inhibitor would be those patients, for example, who had a secondary mutation in the ALK kinase domain. It's a very common way that cancer cells mutate to allow that molecule to continue to drive growth of the cell despite the presence of an ALK inhibitor. So we thought that the next generation ALK inhibitors would work best in those patients. Well, it turns out that only about a quarter of patients have a secondary mutation in the ALK kinase domain, yet we're seeing response rates that are approaching 60%, disease control rates, meaning stable disease or tumor response, approaching 80–90% in these populations. And that really makes us wonder how these drugs are working or how crizotinib is failing eventually in our patients. And I think that you could look at it from the standpoint of, well, these drugs are going to work regardless of what we find on the re-biopsy. But I think we need to understand why these drugs work and why they fail. Even if they work better than expected, we need to understand how that is occurring so that when we design drugs for ROS1 or RET or BRAF or some of the other newer targets that are coming online, that we can really best understand how to pharmacologically inhibit these cancer cells so that resistance is delayed. So I think that re-biopsy is still important, and that it'll help us understand both the eventual failure of crizotinib. It'll help us understand the unexplained, I would say, unexplained success of ceritinib and alectinib in these patients, and help us for the future better designing drugs.